Thanks so much for joining us. I'm delighted to welcome you all to our latest Centre for Care research seminar. I'm delighted that we're welcoming and we're joined by Professor Catherine Needham and Patrick Hall, who are going to be sharing their work today for this seminar entitled Social Care in the UK's Four Nations Between Two Paradigms. So my name is Matt and I'm going to be chairing today's session, and what I'm going to do shortly is introduce our speakers, and then I'm going to invite Catherine and Patrick to share their work for 30 to 40 minutes. So Catherine Needham is Professor of Public Policy and Public Management at the Health Services Management Centre at the University of Birmingham. Her research focuses on social care, including personalisation, co-production, personal budgets and care markets. She's published a wide range of articles, chapters and books for academic and practitioner audiences. Catherine led the Care in the Four Nations work package within the ESRC Sustainable Care team. She's now leading the research on our care systems as part of the ESRC Centre for Care and is also a member of IMPACT, the UK Centre for Evidence Implementation in Adult Social Care. Patrick is a social care policy researcher, currently undertaking an ESRC-funded PhD at the University of Birmingham on care commissioning. He was the main researcher in the Care in the Four Nations work package within the ESRC Sustainable Care team. Prior to that, he contributed to the European Commission's 2018 peer review of Germany's latest long-term care reforms. Patrick's a former fellow at the King's Fund, where he co-authored two key publications on social care for older people. For the King's Fund, he worked with the Department for Health and Social Care, local authorities and NHS organisations on the implementation of the Care Act 2014. I think that's everything. Is there anything I can say before we get started? Well, without further ado, the floor is yours, Catherine and Patrick. Thanks so much.
Thanks, Matt.
Thanks, Matt. So welcome all, thanks for joining us. So we want to share with you today the findings from our Four Nations comparative work around social care, which is also just published a book with Policy Press around this. And it's really the mission that we had in mind was to look at 25 years since devolution, to understand what was going on in social care in the Four Nations of the UK, recognising that it was increasingly untenable really to talk about the UK social care system because of the four being so different and having diverged so much over that period. So next slide, please. So we undertook a comparison between England, Scotland, Wales and Northern Ireland, looking at that period since the devolution settlements of the New Labour coming after 1997. We're not here comparing like for like in the sense of different kind of the different size, scope, jurisdiction of these. It's important to note that England is far larger, is more than 10 times larger than any of the others, and it has 152 local authorities that are looking at organising social care in England. So we've just got a very different kind of scale and scope of social care in England. So that's one of, as you can imagine, various things that get in the way of a neat comparison here. But still, we felt that there was enough of a similar starting point to say what's going on in social care in these four systems. So it was an interview-based project. We spoke to policymakers, key stakeholders from key organisations around the organisation, delivery, provision of care. And we also did a document analysis of what seemed to be some of the key pieces of legislation and policy documents, royal commissions, etc., over that period, as well as looking at some of the data around the provision. And for those interested in such a thing, we took a realist lens. We were interested in how people talked about the reforms, what the kinds of things that they foregrounded, the way that the four talked about each other, as well as how they talked about themselves. And we used as our kind of organising mechanism the realist tools of context, mechanisms and outcomes. So what were the sort of contextual elements that were present in the Four Nations, what policy mechanisms were put in place to reform over that 25-year period, and what were we seeing in terms of outcomes. So next slide, please. And we framed it around the sense of crisis. I mean, it's such a kind of, almost a cliche really to talk about the social care crisis, because a crisis suggests something which is urgent and needs sort of fixing with a lot of attention, and actually we just kind of rumble on in an almost permanent state of crisis now. So that very word is somewhat problematic. But we framed it around sort of this notion that there was a crisis of demand in the sense of a rise in the demand on social care services for various reasons. And in terms of the sort of supply side in response to that demand, then we identify these kind of the sort of 4 institutions and structures that often we can expect to respond to a demand for social care. And by social care, we're talking about care for older people with additional needs, working age disabled people, and people with a long-term mental health problem. So we recognise that this is partly a crisis of family. It's about the kind of the way that family care patterns have changed, and also a sense that the changing pattern of family care in all of the 4 nations is not necessarily mean that family has withdrawn. We know that there's an enormous contribution made by unpaid carers. There's a great Carers UK paper out last week by some of our colleagues around the contribution that unpaid carers make and how enormous it is. So concern really, I think, about the overload of unpaid carers. We saw it partly around the crisis of the state. What's the state for in response to adult social care? That for some people the state doesn't do enough, but then there's also a kind of disability rights critique that the state does too much, and when it gets involved it tries to lock people up and do awful things. So we need to not just have a kind of solution that let's have lots more state in this space. That might not be the answer. Lots of attention around the role of the market, the role of profit, for example, in the social care space, and whether that can ever have an adequate role and what that should be in terms of responding to demand. And in some ways, community is perhaps a space of greatest optimism, where there's a feeling like if we just get community to do more, whether that's not-for-profit providers, whether that's people's faith organisations, their neighbourhoods, the things that might provide more support, but actually lots of the kind of community infrastructure has also come under strain over recent decades, which might mean that actually there's just not so much of it around anymore. And I guess just to note that in the literature we might say for some people the family, the state and the market are not doing enough, and others say they're doing too much. So we're kind of there's not agreement necessarily on exactly who should be responding to this demand and how. Next slide, please. So in terms of context, we just wanted to talk a little bit really about what we found from some of the available data. And one of the things we'll know, and you probably know already, is the data is very poor around adult social care. And again, there are people here that are trying to improve that. But just in terms of some of the headline data, so I guess around ageing population, we can see that Wales has the oldest population according to this ONS data. And you can see the youngest population in Northern Ireland. In terms of next slide, disability prevalence, again we can see that the Wales, where the greatest, you can see disability prevalence as being highest, and similar patterns in the other nations. Next slide, please. And then also in terms of contextual information as well as prevalence, we were interested in kind of the spend, how much money is available in this space. And again, there are fluctuations, but I think the clear takeaway from this from this slide is of England as spending much less than the other nations on social care. So in terms of what's spent.
And I think, accepting there's a huge disparity within England and as well within the 4 nations.
Yeah, of course. So yeah, these are all generalizations, but the kind of in terms of our data and the people we spoke to and the context, the urgency of austerity in the funding crisis was much more strongly articulated in England than it was elsewhere. Next slide, please. And we can see this slide breaks up the funding by working age adults versus old age, and so we can kind of see that it's not quite 50-50, it's pretty much 50-50 in England, but we see slightly more spending on old age in Scotland and in Northern Ireland, and again you can see that the lowest spend is in England and highest is in Northern Ireland, so that's important contextual background.
The work that Matt did with Yanan shows that the biggest portion of cuts came in older people's services, so you can see that where in England austerity's hit a bit harder than in the other 4 nations, that's had a direct impact on older people's services, mainly where working age adults spend has held up relatively.
Next slide, please. And then this is interesting. It's always interesting to see the outliers. I think what this shows is the different age profiles around funding. So this is just state funding. We know lots of social care funding happens outside the state through self-funding. But if we just look at state-funded, of the people who are funded by the state, then what's interesting is that Scotland here is the outlier in terms of the people funded, the older people funded in Scotland. So that's a feature of the free personal care that we see in Scotland. So that's the most visible representation there of that. So if you're an older person in Scotland, you're much more likely to get funded through the state. Now, there are other factors going on around levels of poverty. So England is the most affluent nation, so that also makes a difference here. But I think that's quite stark there to see that higher prevalence. The high number of state-funded clients in Scotland, particularly because we know from one of the earlier slides that Wales has got the oldest population, so we might expect to see more there. Next slide. So we need therefore to distinguish between what's going on in these four nations. So that's one of the things that we did through our interviews, is sort of to get a sense of kind of what people are talking about as being the kind of the key issues in the space. And because of that expenditure profile, we can see that in England, that was largely talked about around austerity, around the cuts, around a move away from the sort of new Labour era up to 2010 as being one in which there was reasonably well funded, at least in historical terms, but then moving into that decade of austerity, and that was really a key background, and that COVID-19 and Brexit were then further pressures on an already pressurised system. So I suppose just a quick aside on COVID, which is that we started our project before the pandemic. We did some of our interviews before and then some during. So we kind of that creates a slightly a bit of a kind of timeline, I suppose, in our data and the kinds of things that people were talking about. But it did mean that we were able to kind of understand in real time what was going on for local authorities and other key actors around COVID. And it also around Brexit, a lot of the kind of concern, I guess, people we were hearing was we just don't quite know what the impact's going to be yet in terms of kind of workforce, but it's just adding to uncertainties and stresses in a workforce context which is already very pressurised. So in Scotland and Wales, when people were talking about crisis, it was more about kind of rising demand, changing demographics, the need to kind of really get on top of and understand how to respond around social care, but less in the context of a particular kind of financial strains. And then worth, I think, distinguishing Northern Ireland again, where the crisis was often really talked about more around the political system. So looking over that 25-year period, some long periods of inactivity with no executive in place, suspension of the executive during that time. Really over the course of our research, we saw things come and go. We know that there's then been kind of more recent problems since the most recent elections last year. So it's been very difficult for Northern Ireland, I think, even to get to the place where some of the other jurisdictions have got to, in the sense of having relatively new legislation on care, having like a legally defined right definition of carers, and particular rights that go alongside that. So the crisis for Northern Ireland was really talked about more as a sort of administrative and executive crisis of just simply being unable to get to the point of where the other jurisdictions were up to. And so in that sense, this kind of notion of crisis was responded to differently, and we could also see that in terms of how far, where the solution to the crisis was going to come from. So as you might expect, more optimism about the role of the state and state solutions in Scotland and Wales, which has been kind of more social democratic nations, versus in England, where it's assumed that some different kind of configuration of the market, some different shifting of market levers and incentives will be the way in which we deliver more provision and move into a more sustainable social care position. So having set out that kind of contextual basis, then it's important, I guess, to set out what we were finding in the policy documents around what were all of these different care systems trying to achieve. And really, we found a lot of consensus in what they were setting out in their white papers, key policy statements around some of these principles, as you might expect. So we talk in the book a bit about some of the tensions here. So the emphasis on fairness can be about kind of thinking about some of the kind of issues around who pays, what constitutes the kind of fair settlement, how far do we think that people who've saved up for their old age should, is it a fair system if they are then required to spend more money on care than people who haven't? So there's some really interesting issues around kind of fairness in this space, and the way in which that then intersects with rights, which are more kind of absolutists and are not necessarily related to kind of some behavioural issues. So, so there were some kind of interesting points there in terms of tensions between fairness and rights. We also saw some issues around how quality gets defined and the extent to which quality is about the quality of the care experience at the front line, or whether it's about the quality of work for people. So whether it's, we saw more discussions around fair work and quality work in Scotland and Wales than I would say was evident within the English context.
Yeah, quality for whom? That was the question. It was kind of different for different respondents talk about quality, for a quality of work type of care versus a quality which is focused on either the recipient or a service type, so from a kind of inspection perspective or from a service user perspective.
Thanks. So next slide. So we moved on then from the kind of context then to look at the mechanisms which were being used, the kind of policy instruments which were being used to kind of fix the crisis, to improve social care. And we identified that, again, in all 4 jurisdictions, there were really 6 different things going on in relation to care. The big one in all of them was thinking about how to distribute the costs of care, and what some of the different mechanisms were through which that might be. We might move to a more sustainable financial settlement for care. And I guess there's sort of 2 main models really here that are on the table. There's the Scottish approach, so that's free personal care for older people, non-means tested personal care, which is, and then moved to now being also available for working age disabled people, versus the English approach, which is about capping personal care costs, and so not providing that kind of universal support, but providing some protection for people who might incur very high social care costs, that they would be capped in a way that probably there is no cap as long as you are above the means test threshold. And obviously we know that those of us who are based in England know that the care cap is a kind of policy that's sort of limps along. It's been passed into legislation twice, and yet still its implementation remains out of reach. So it's, was going to be implemented later this year. It's now being postponed until 2025. I think if we did a poll of people on the call, I reckon people might, we asked whether this will ever be implemented. I think we might find that people would say no, but time will tell on that. So one of the things then is thinking about how to shift the cost, and again, seeing different things going on in the 4 nations. So as well as Scotland and England that we've talked about, in Wales, the approach has been to put a maximum weekly charge around home care, and also to increase the means test threshold, which we haven't seen in England or Northern Ireland. Then around kind of personalising support. So we know that personalisation, person-centred support have been really important narratives in social care over the last 25 years or 20 years. That language of personalisation was seen by our interviewees has been very English, so and kind of slightly individualistic and more market-based. So in Scotland and Wales and in Northern Ireland, more talk around self-directed support, and Scotland having flagship legislation around self-directed support, but actually all pulling in a very similar direction really about how do we move more choice and control down to the individual, to what extent do we make funding available more on the individual basis rather than kind of giving people a set of services. In terms of supporting carers then, we see slightly different patterns but a similar direction of travel around unpaid care in all of the 4 nations. So with the exception of Northern Ireland, all having legislation around protecting the rights of carers, giving them equal rights in law to people who they're supporting. In Scotland, making carers' benefits more generous, and moving more into kind of recognising very much the vital role that unpaid carers play within the social care system, and how they can best be supported. Concerns, as I'm sure you're already thinking, around the implementation of a lot of this, but I guess here we're talking particularly about what's on the statute books and what are kind of formal policies in place. Prevention's an interesting one because, again, we see it in the legislation. It's been a real drive in all 4 of the jurisdictions to try to think more kind of upstream about how we keep people well, how we keep them embedded in communities, delay or prevent the need for statutory social care and support, so that kind of early intervention piece. As I think we'll get on to, we started to see in the interviews some tension here between, so for example, in Scotland, we can say that the push towards free personal care has potentially come at the expense of thinking about things like prevention and upstream investment, and has potentially provides, some shifting away from attention on things like self-directed support. So we're starting to think about what are some of the interactions between these 6 kind of pillars, if we think of them like that. Integration with health has been a key approach in all of the jurisdictions. In Northern Ireland, we know that on paper they've had integration with health since the 1970s. So in a way, we might be thinking that Northern Ireland would be the place to look for learning for the rest of the UK about how to get integration with health, how to manage the kind of structural side of that, and to ensure that when people are kind of have a set of needs that we're not trying to do, as we currently do, separate them out to what are your social care needs and what are your health needs. I guess the interesting thing about Northern Ireland is that it's struggled with lots of exactly the same problems that the rest of the UK has struggled with around not being able to get people out of hospital, into social care packages, not having sufficient social care provision within communities. Some of the rurality in Northern Ireland, but also in Wales and Scotland, just put further pressures on provision. And that integration with health, we can say in all of the jurisdictions is really unfinished business. So obviously in England, we're moving now into integrated care systems. In Scotland, we've got integrated joint boards, but with the proposed national care service, that's all been kind of thrown up in the air again. So the kind of exact infrastructure through which you approach this remains, I think, unclear exactly how best to achieve that and how you do it in a way that doesn't ensure that this is a kind of helping social care help the health service, and failing to appreciate what social care is really about, which is encouraging people to have flourishing lives, and to move them beyond a focus on their deficits and what's wrong with them and how you fix them, into really thinking about how do we support people in their communities and their lives. And then the 6th element is around the staff, the paid workers within social care. So how we might move that into a much better paid, better skilled profession, and deal with some of the enormous problems around workforce vacancies and an inability really to make that sustainable and adequate workforce. We know that in Scotland, Wales, Northern Ireland, they've done that through a more explicitly professionalised route through various forms of care worker registration and regulation, and that we don't currently see that in England, although there have been some hints around a kind of carer's passport, which might move, care workers passport might move us in that direction. But what we, I think, found, even in the places that have gone further on this, was some nervousness about how far this will be the route to better work, fairer work, better quality work within social care. Some concern, and we saw this in Scotland in the Feely report, which preceded the proposals for a national care service, that this is really about kind of policing care workers rather than actually supporting them, that there is concerns that it's disincentivizing people to come in because of its in some of the areas focus on particular kind of qualifications and requirements.
Administrative burden for providers there as well.
Yeah, so the sort of costs make this problematic, and some concerns around disability rights movements about whether making social care more like nursing is really the right direction to go in, that there are reasons why that could be advantageous, but there's also reasons to be nervous, and that we need to make sure that if some parts of the social care workforce are going to become more professionalised and regulated, we still need to make space for personal assistants and parts of the workforce that don't necessarily fit into that very professionalised space.
Shared lives, home share, there's this concern that it stifles the diversity of provision.
Yeah, so then in terms of outcomes, we've alluded to some of it already, but we can see in all of them, I guess, a kind of somewhat disappointing performance on all of those 6 elements, really, in terms of what's been achieved. Partly there's issues around data, so this issue of We don't have a lot of data around social care outcomes, and so it can be difficult to say kind of where, although they're all talking about becoming more outcomes focused, how far they've actually achieved that. So I do like this quote from the Director General of the Office of Statistics Regulation. There's not much a gap, as a chasm, and so actually our understanding of this, remains kind of very patchy. And obviously, with our kind of mainly qualitative data, that's one thing we tried to contribute to. But there's a big gap there around better quantitative data in relation to social care. So you can see on the next slide, which is really here just to partly to illustrate the problems of data. So this is about satisfaction with social care services as people who are using state services. So we can see, for example, for Northern Ireland, we've only got one data point, so we have no idea from this available data whether Northern Ireland is going in the right direction or the wrong direction. We can see that England here scores very highly compared to the others, and that's been kind of staying relatively high. But then if we compare that with other data, such as the British social attitudes, we can see that satisfaction has gone down quite steeply with social care. So I think there's a lot of scepticism really about whether this kind of satisfaction data is really the data that we need to understand what's working well within social care. And if we look at another potential measure of kind of whether we're moving in the right direction, so here this would be on the kind of personalisation agenda, moving to more individualised funding. We've got kind of problems with the comparative nature of the data. We've got gaps around the Northern Ireland data. So apart from seeing that England is going down, although from a higher percentage, and seeing how low some of the other nations have been in this space, and Scotland in particular has been really not really picked up the kind of direct payments agenda despite the Self-Directed Support Act in a way that we might expect. So I think there's going to be that some of this sort of personalisation and more person-centred care part of that agenda has been really disappointing. So, and then this is final slide for me before I hand over to Patrick. We would say we've kind of grouped the countries together. We've sort of given them kind of labels around where we think they're at. So we would say that Scotland is the most active, certainly legislatively around this space, that it's pursued change in pretty much all 6 of our areas that we identified, or we could say there's been specific legislative change, that some of the implementation has been disappointing, but that particularly as we were kind of finalising this work, when the National Care Service looked like it was full steam ahead. I don't know if I'm quite so optimistic about that now, but that they really had pursued a very active legislative agenda over the whole 25-year period, and the things like picking up free personal care when the rest of the UK, England in particular, said that it wasn't affordable, moving forward on carers' rights and improving carers' benefits. We would say that that there's been most kind of activity and delivery really in Scotland in this space. We found in Wales that because they were paying administrative catch-up in terms of the institutions that they were given in devolution were weaker than the institutions that were given in Scotland. It took them quite much longer, really, I think, to gather their momentum around change. And so it was only really with the Social Services and Wellbeing Act around 2013-14 that we then see them starting to move into that more active space. But we see that as kind of something that's a bit more emergent. In England, we've seen lots of exactly the kind of legislation that lots of people in the room on the call would probably see was exactly the right kind of legislation, but implementation has been extremely disappointing. And we asked, we do moving kind of through this cycle of promise and enthusiasm and real lack of delivery and continually pushing things down the road. And then in Northern Ireland, the sense it's still because of the position with the executive. So the civil servants that we interviewed really talked about getting as far as they could within a kind of civil service jurisdiction, but that they were limited by the lack of new primary legislation around social care, which the other parts of the UK have had. So I guess just to kind of sum up this part, we can see that it's been a period there's been lots of activity in all 4 nations and lots of talking, lots of commissions and reports around how do we fix the crisis, how do we solve social care. Even in Scotland, there's some of that's been disappointing, but we kind of think that we still got kind of ordering of the nation, still feel like it's about right in terms of who's gone furthest, fastest, and who looks to have the momentum as we're going into, just finishing off this sort of phase of 25 years of evolution. So Patrick, over to you.
Thank you, Catherine. That's really great summary of the findings. You do it so well without any notes, so I can't promise to do as well. But yeah, I mean, so the question there is, why the difference? Why is there such a difference between the four nations? And we identify scale as being an important factor. So the size of the political community and policy community really matters. It impacts the task and the relationships of policy making, and that size difference of the policy community means that there's certainly, we found certainly in the responses in the interviews that there's more scope for a kind of collaborative, more interpersonal governance style, where there are kind of more negotiation points, I think they call it in the literature. There are more opportunities to negotiate on a kind of iterative basis, rather than these kind of big set point negotiation points, which happen maybe in the Westminster system. And this in turn impacts the style of the policy communities too. And we think this is particularly important when it comes to this idea of kind of, I think we at one point called it anti-isomorphism, which was a bit of a headache, so I think we got rid of that. But this idea that we don't want to be like England. We don't want to. It's like we watch England and we kind of think, well, we don't want to go down that line. And there's all sorts of kind of narratives about England being kind of more market focused or kind of more individualistic, and sometimes that really impacts the style of policy making in the devolved nations. And there's that sense of kind of community solidarity, I suppose, among policymakers of different types. There's this kind of the Westminster system is kind of holding them back. And there's a real sense that comes through in the interviews. And of course, there also exists a huge difference in the possible scope for institutional impact. So, Wales still emerging, as Catherine said, kind of from the kind of hamstrung institutional settlement that they had at the beginning of the devolution settlements. Northern Ireland obviously having a fundamentally different character to the other administrations, kind of emerging from those institutional arrangements being constantly in crisis. But what was interesting, just to go back to what Catherine was saying about the Northern Ireland civil service, is really interesting. The kind of inversion of power there is that the civil service and the kind of the informal administrative tasks, they've become much more the centre of kind of keeping the system together, rather than the politicians and kind of the centre of pushing. It would be the politicians contacting them about changing things rather than the other way around. So there was a sense that they were together in keeping things together. The policymakers, civil servants, third sector organisations, and that kind of closer, that kind of camaraderie about, even though we haven't had this legislative change, we are keeping things going, as they are, preventing things from getting worse, I suppose. Go to the next one. So I'm not sure I've covered anything. So I think one of the key things that we found is that the arenas of care reform, those mechanisms for achieving the 6 pillars, as Catherine put it, redistributing costs, personalising support, supporting carers, investing in prevention, integrating with health, professionalising the workforce. They don't straightforwardly make a coherent project. There are all sorts of tensions that exist between them. The good example is that one around registering care workers. Is that kind of, on the one hand, we want to professionalise the workforce, we want to protect workers, give them good and decent work, but also we want to maintain a real diverse and personalised set of services. And there is a tension between them. It's not that they're completely opposed to each other, but there are some tensions in them, and that's really why we feel that so all of these different policy mechanisms, they form a kind of more dynamic and relational policy mix where different interests and ideas are kind of competing and complementing more or less, and so that big bang approach, kind of most notably in Westminster around the Care Act, this idea that we can fix social care once and for all kind of thing. And, it's most famous in Boris Johnson's, we're going to fix social care once and for all. That's unlikely to be sustainable because of this kind of dynamic and difficult policy mix, which makes up social care policy. It's not something that needs to be fixed, but it's something which is an economy, an organic system which needs attention and prioritization and iteration, and that attention to the policy mix is what we think is kind of really missing across the 4 nations, I think. And there's some ways in which we kind of ignore the differences in order to kind of, all get together and say, yes, we've made something great here. And I think that was the case with the Care Act, and possibly the case with the other big set pieces of legislation in Wales. Next slide, please. So when interviewees are kind of asked about the future of social care, their vision for the future of social care, they often refer to one set of priorities which form a more coherent whole. And these kind of roughly formed 2 groups, those that, refer to personalisation, prevention, the development of caring communities, and then those who talk about better funded, safer institutions with more professionalised workforce, delivering safer care, more integrated in some settings, and as part of the NHS, part of this kind of grand state project. So we call these 2 groups, or 2 sets of ideas, which feel like they form more of a kind of coherent ideology together as the kind of 2 paradigms of social care policy. Thanks. Yeah. So, the differentiated paradigms is kind of often advocated by those associated with the interests of working age disabled adults, people who are seeking independence, inclusion, and this standardised model is often pursued and advocated by those representing the organisations, NHS organisations, care workers, state bodies, regulators, and often with a kind of politically left-wing perspective sometimes. The standardized paradigm is emphasized by those often who advocate for frail older people's needs. So those are associated with kind of smooth institutional transition, more professional assessment, a kind of a more medicalized model. So we've got a quote here in the next slide. It's a bit lengthy, so I do apologise, but I think he does. Professor Nick Watson in Glasgow gave some evidence to the Scottish Parliament about the Feely report. I just think he really sums it up really well. So he says, on the one hand, it suggests that good social care is the product of people power, the co-production of services and the diversity of approaches that are adapted to meet the needs of the locality and the needs of each service user. On the other hand, it calls for centralisation and standardisation and institutional power through a national care service. These 2 approaches seem to be in tension with each other. And as I read through the report, I really struggle to see how they can be reconciled. And that really struck us as something which kind of, it really resonated with us and the findings of our research. So just to kind of sum up, all 4 nations have reformed their care services, have really kind of have changed things, and things have changed, despite the lack of institutional and policy and legislative change as well. Like Catherine was saying, I think we probably would strike a little bit less of an optimistic note about Scotland given current events. But we feel that it went farthest in terms of the iterative approach that we were talking about, actively trying to address perceived problems in the system. But none of the 4 policy communities are clear about how to combine these different paradigms and what the tensions are between the 2 and how we can negotiate them. That's what we think is the kind of big problem going forward. We think we should ongoing, be really worried about this kind of once and for all fixing social care narrative, and kind of focus on something which is good enough, a bit more clumsy, a bit more trying to get through and to pay attention to something which is important to all of us. We also published an article in Social Policy and Administration, which kind of in our article, so we kind of more closely go into some of the institutional factors, but again, I'll put a question mark there about whether we should have looked more in Scotland, and we're probably quite optimistic about the chances of National Care Service being implemented. But yeah, you can see here, it's coming to terms with cost, coming to terms with building in iterative automaticity within the policy instruments, facing up to veto players, facing up to partisanship in the different systems, thinking about how to deal with uncertain outcomes as the policy is implemented, and then how to keep focus on social care, something which is kind of very psychologically unattractive for politicians and for policymakers. Those are some of the big problems, and I think it's our last one. Yeah. So those are the two questions really for everyone here. I think it's about how can policymakers be more attentive to breaking down some of those institutional barriers to reform. So some of the things that were scuppered previous attempts. And what should the process look like? How do we negotiate between these kind of two paradigms which have tension with each other? And how do we do that in a kind of honest and open way? Which means that, we give ourselves a bit more chance of success.
So, all right, thank you very much.